Not intended to replace clinicians or clinical judgment, AI serves the purpose to enhance and complement the very human interaction of provider and patient. In healthcare, AI is changing the game with its applications in decision support, image analysis, and patient triage. With their ability to reduce variation and duplicate testing, decision support systems quickly decipher large amounts of data within the electronic medical record. AI technology is also taking the uncertainty out of viewing patient scans by highlighting problem areas on images, aiding in the screening and diagnosis process. Artificial intelligence helps with the issue of physician burnout by collecting patient data via an app or text messaging. Chatbots now ask patients a series of questions regarding their symptoms, taking the guesswork out of self-diagnosis and saving both the patient and provider time and money. With the AI integration, working smarter enables solutions to a variety of issues for patients, hospitals, and the healthcare industry.
Well, this was an intro video, and first of all, my disclaimer, I'm not an expert on the subject, but I'm really fascinated about it, and I hope after my presentation, some of you also fall in love with this topic, and it is actually very, very interesting. Introduction, I think you have to be familiar with some of the terminology, which I'm sure many of you, at least the young, I think everyone here is young, so they know these terminology. Artificial intelligence, in its true sense, this new technology is not intelligent. I asked ChatGPT itself, are you intelligent? I asked her to answer in just one word. The answer was no. So it is not truly intelligence, but it is like simulating human intelligence. Deep learning, large language model, ChatGPT, BARD, etc. There are many other terms, so I'm going to skip that part to save time. We have many brilliant presentations since morning, but you will have to bear with this one also for 20 minutes. Artificial intelligence has increasing significance in almost all fields, agriculture, education, and everything, but I believe it has got a lot of potential to revolutionize the healthcare because we are too much dependent on technology these days. Diagnostics, therapeutics, new development of new drugs, and I think everything is based on this technology. Professor Zaman Sheikh mentioned about artificial intelligence, and other speakers also mentioned about artificial intelligence, and I think I'm going to sum it up now. The definition is simulation of human intelligence. It's not exactly the same as we think or we analyze or we think. It's like trying to pretend like that, processed by machines, including learning, reasoning, and self-correction and self-learning from machine's own experience, but not conscious. Machine is brilliant in memorizing and reproducing, but is not conscious. AI is not intelligent in the true sense of the word. So if we compare human intelligence with artificial intelligence, this is the comparison. Capacity to memorize and retain and recall, I think artificial intelligence clearly outweighs humans because it has almost limitless capacity. Subjectivity, compassion, and empathy, I think we human are winner. And self-learning, we learn from our own experience. If we do something wrong, immediately we learn next time to do it the other way. But machine is also learning. Machine is not just memorizing, machine is now learning. This is actually the core component of artificial intelligence. Pattern recognition, if you know a pattern, if you know somebody, it takes a fraction of a second to recognize that person because that pattern is printed in your mind. And the moment you have a look at that person, you recognize that person. But when it comes to speed, recognizing hundreds and millions of people or hundreds of millions of images and slides, machine clearly, I think, supersedes. Efficacy, Of course, machine can do much more work than we do, because machine doesn't get hungry, machine doesn't get sleepy, machine doesn't get tired. And overall, I think it has to be a collective work. Human take the lead, but machine there to assist. So these are some of the areas where machine can help in diagnostics, in therapeutics, in research, in genetics and personalized medicine, drug discovery, epidemiology and predictive analysis, virtual health assistant, remote monitoring and telemedicine, and very fascinatingly, surgery. Machine is very, very good if it has to do something repeatedly. But with artificial intelligence, it would customize. For example, giving the dietary advice to somebody, it would not just play the recorded audio, it will customize according to the person sitting in front of the machine. So some of these things I will take one by one. In the diagnostic, for example, artificial intelligence is being used for early disease detection and diagnosis, and the first specialty which adopted artificial intelligence was radiology. Because radiology, this modern radiology, consists of data. There's a lot of data. All these images you see, CT scan and MRIs, they all actually consist of small amounts of data. So first application of AI in health was X-ray, CT, MRI, and pattern recognition. It can recognize the disease processes. It can very easily pick up infarction or metastasis or hemorrhage. It can actually foresee before the ischemic changes develop. It can foresee the changes and can triage. For example, if the radiologist has to report 100 images, it can triage these images. They potentially show something serious which could require immediate attention. In trials mammography, machine has actually surpassed humans. Machine can pick up, these are actually artificial enabled machines. You need a software as well as a hardware. They can pick up breast lumps better than humans can. And radiologists will still be needed for at least some couple of years because this technology is still evolving. Another thing in diagnostic is pathology. You know, pathologists, they see many slides. So this artificial enabled microscope, they can see millions of images and can immediately recognize a remotest possible malignancy also. I think that is an advantage. And disease detection, I practice internal medicine, but I do see patients with skin disorders also. They come to me, at least I don't actually treat them. For example, psoriasis. Every other day I see another presentation of psoriasis. I'm still learning new patterns, but machine can immediately, machine must have seen maybe millions cases of psoriasis, and even the oddest case, machine will have no difficulty in picking up that this is psoriasis or this is malignancy or this is this or this is that. Another field where artificial intelligence enabled retinal cameras have found their place is these diabetic retinopathy. Very early, when even human can miss early changes, machine can pick up diabetic retinopathy. It takes only 5 minutes to scan a person without dilating pupil to give a complete diagnosis of retinal picture. Other diagnosed arrhythmias and ischemic heart disease, we have smart watches which can pick up arrhythmias and they can report to your cardiologist. And remote monitoring of all kinds is possible. Remote monitoring of glucose, Professor Zaman was mentioning, is also possible. Other thing in diagnosis, genetic testing and personalized medicines. We look very much similar. All of us have 2 eyes, 1 nose, 1 mouth, but actually genetically we are very different. And similarly, metabolically we are very different. Microbiome, we have a different microbiome, we are very, very different. So I think with this new technology, it will be possible to generate a specific prescription. I'm hypertensive, Rizwan is hypertensive, for example. The treatment for me may be different than him because of different genetic makeup or different metabolic profiling. So I think that is another very important thing. Now coming to therapeutics, AI analyzes patient data to create personalized treatment plans, genomic and microbiomic profiling. Everybody is absolutely unique. No humans on this globe are similar. Metabolic profiling, like it was mentioned in the morning, there are some people that do not respond to aspirin. And how do you find that? AI-enabled system can find out that this person has got this kind of metabolic profile, is slow acylated, and he is unlikely to respond to aspirin. So that is not right medicine for that. Early detection and intervention in critical care settings like trend in septicemia and shock, machine can warn you a coming shock well ahead of time. So artificial intelligence analyzes disease prevalence data to create research plans, number of people to reach the conclusion. We have to calculate, but machine can do it much faster. Geographic areas to be included or to be excluded. Machine can tell where to find the patients, and interpretation of data in real time. You don't need periodic meeting. The data monitoring board will also have almost real-time finding what is the trend. Genetics and personalized prescription, AI has the capacity to store and analyze a massive amount of genetic data, prediction of familiar diseases, selection of medication on individual basis. The example I've already given. Drug discovery. In the morning we were mentioning about these drugs like tirzepatide, and which is actually a GLP-1 agonist, GLP-2 agonist, and then the third one, retaglutide, which is GLP-1 agonist, GIP agonist, and also glucagon inhibitor. Now this just didn't happen by chance that they found some molecule which has got three unique ability which are in favor to achieve a metabolic purpose. So this is actually was possible with drug discovery using artificial intelligence. It takes approximately 5 years to analyze one protein. You can do one PhD by doing analysis of one protein. And DeepMind, which is one subsidiary of Google based in London, it has already analyzed 200,000 protein molecules. So they can use those molecules for various purposes, and they will know which molecule can help in which disease or which rare disease. Epidemiology and predictive analysis, AI can predict disease outbreaks and patient outcomes. Planning will be possible. If we had known that COVID is coming about 6 months earlier, probably we would have done better. AI-powered chatbots and virtual assistants for history taking. Machine can definitely take better history than we can, at least more thorough. Counseling about disease, customized dietary advice depending upon your disease, your weight, your genetic background, customized exercise plan, appointment scheduling, and finding concerned consultants. This is all possible with machine, chatbots. Automatic machine, you just call a number and machine will reply you, and you ask any question, relevant question, it will give you the relevant answer. Remote monitoring of patient with the help of AI-enabled hardware, especially used for chronic disease management, and AI in surgical robots and assisting during complex procedure. Now these are some of the things. Robots which are AI-enabled, still done by humans, but with precision and accuracy, robot-assisted surgery, navigation and guidance, patient-specific approach, because we have different anatomy. The exact location of my gallbladder may be different than another person's. So I think machine can exactly find the right place. Remote surgery, it is possible to do surgery in a remote area where the required specialist is not there. Skill enhancement and training, continuous monitoring and post-operative care. All this possible. Improved efficiency, AI can surely improve efficacy as it has got limitless capacity. AI can surely improve and streamlines administrative tasks by reducing paperwork and improving operational efficacy. You know, in developed world, half of the work of doctor is documentation. We are not actually very particular about documentation, but machine can take that part. I think machine can do the documentation and improve your efficiency. Might bring the cost down. You might be wondering how. Of course, initially it would cost more, but since it has got limitless capacity, it can do the job of 10 or 20 different humans. So ultimately, I think the treatment cost will also come down, at least of some diseases. Some real world examples. There are many successful AI implementation in healthcare. There's IBM Watson for oncology, which can give you the diagnosis of the rarest malignancy, and based on that person's profile, it can give you the advice what kind of radiotherapy or chemotherapy is right for that individuals. Path AI is similar, like pathology, diagnosis slides, Zebra Medical Vision, another one, CyberSight, the Retina, and Google's DeepMind. I've already mentioned chatbots and virtual health assistants. They can serve you as your assistant. Now, I was really fascinated by this Da Vinci surgical system. This is a robot-based surgery. Still, the man behind the machine, there's a man behind the machine, but most of the procedure is done by the machine itself. Now, I'm just going to show you this video. This is not the surgery on a patient. This is just like a grape being peeled off. Just see the precision. Imagine this kind of precision when done in human. It is possible to remove a particular part of the pancreatic tail without disturbing the rest of the pancreas. It may be possible to take out a deep-seated metastatic lesion in the liver. So I think with that, I think I maybe skip this. Now, another real example, in response to and this is actually the real case, there was a patient in my ward, and in response to my query, I just fed in the information. Like I would ask my senior Professor Javed Akram, give him the story of this patient and ask his advice. And this is the response I get. I would not read through it, but it is very much human-like. If you're interested, you can read through it. I think it is exactly the same response which I would expect from Javed Akram Sahab. Paragraph, capitalization, commas, everything in place, very much like human response. So this is how machine can help you. If you're working in a small hospital where there is no senior, you could take help of AI. And this is free chat GPT 3.5, which is available on internet. Now then, one very important feature of this AI is the ability to convert text to speech. And this is again a real example. I could ask the machine, giving my text, and ask the machine to make a presentation on my behalf. And I could actually lend it my voice also. The machine would read in my voice. You would not see my face, but you will hear my voice. And this is one text which I fed, and I'm going to play it.
Are you a medical student, postgraduate trainee, or a young consultant? And looking for medical lectures that are credible and up to date? You found the right YouTube channel. MedStaand. It offers state-of-art lectures on all topics in internal medicine absolutely free. Join today and keep yourself updated. Thank you.
This is machine's voice, not any humans. You could choose from man and woman. You could choose between a thick voice, low pitch voice. You could increase the speed, and you could also choose between an exciting voice or a polite voice or whatever kind of voice you want. And you could also, so the future possibilities are enormous, believe you me, and this is inevitable. Potential concerns and challenges, ethical consideration, data, privacy and security, and implementation. And we are all very resistant, inherently very resistant to change, especially when you perceive that change as threatening you. So we are very, very apprehensive. I think that is going to be a big issue. Resistant to AI adoption, technical complexities and integration and into existing healthcare system is going to be a problem. And this is the list of potential issues: ethical and regulatory compliance, algorithm bias and fairness. An algorithm, this is all run on the algorithm. The algorithm which is built in USA might not be applicable in Pakistan without modification. So we would have our own data. So validation and clinical acceptance, cost and resource constraints, integration with existing workflow, lack of standardization, education and training. Again, many of us may not be very happy working with computers, so this machine is going to be even more complicated. Patient trust and consent. Patient might not also trust this machine. So I think we will continue to work as like interface with the patient. Regulatory hurdles and maintenance and updates is going to be issue. So ladies and gentlemen, I'm coming to the conclusion. AI has great potential in health, like in diagnosis, management, monitoring, administration, drug discoveries, research and surgeries. It will surely have some teething problems, but will surely outgrow them. So future healthcare will be very different than what we do today. So is AI going to replace us? This is a very critical question. Many people, it might replace some specialties to large extent, but it cannot replace doctor as a whole. This is the quote which is attributed to Charles Darwin. This is my last slide. It is not the strongest of the species that survive. You all know Darwin, the theory of Darwin's survival. So it is not the strongest of the species that survive, nor the most intelligent that survive. It is the one that is most adaptable to change. So let's change and adopt AI and survive. Thank you very much.